Pregnancy is supposed to be a cause of joy, but for many Nigerian women out there, it's hardly the case. Their numbers are staggering. At the moment, 1 in 34 women die from maternal-related causes. 135 women die every day in Nigeria from pregnancy-related complications. Nigeria accounts for 23% of all the global maternal deaths. Against this worrisome backdrop, we shall be trying to identify possible psychological, cultural, infrastructural, and sociological angles to this problem. Our guest is going to be Dr. Ifeanyi Nsofor, Medical Director and Chief Executive Officer of EpiAFRIC, which focuses on improving population health through expert research and data analysis, project design, evaluation, health and communication, advocacy, and training. This is a staggering problem, Dr. Nsofor. Quite a very staggering one. Maternal mortality, it's on the increase in Nigeria. 1 in 5 deaths as regards childhood diseases and things like that. It's just a very despicable case in Nigeria. How do we come out of this quagmire?
Okay, thank you so much for having me. I think you hit the nail on the head. So let me just start by saying that maternal mortality is a woman dying either during pregnancy, childbirth, or 42 days after delivery. So, just to give us the span. And I like the way that UNFPA puts it that no woman should die while giving life. And for us to talk about maternal mortality, we need to understand, what civil society organizations have termed the 3 delays. There's a delay in a woman and her family realizing there is a problem so they can seek care. There's a delay with, leaving home and getting to the facility and delivering safely. There's also a delay in getting to the facility, and for different reasons, the woman would die. So what we try to do through the Giving Birth in Nigeria project, EpiAFRIC, Nigeria Health Watch, as well as AfriCare, and supported by MSD for Mothers, is to hear from community people. Because the statistics that you mentioned, about 58,000 women die every year during pregnancy, childbirth, or 42 days after in Nigeria. And somebody has put it in perspective to say it's like filling a commercial jet with pregnant women and deliberately crashing the jet every day. Because we know the things that kill women, and ideally we should be preventing them. So the Giving Birth in Nigeria project, we wanted to hear from community members, to hear from them to say, what are the different reasons why women die in your community from pregnancy and birth-related complications? So we went across, 6 states as well as the FCT to hear from them, and it's quite staggering and very unfair. And so and that's really the core of that report is what we want to talk about today.
Well, maternal mortality is a consequence, right? And in Nigeria, we have one of the highest rates in the world. But what do we do about maternal morbidity, which leads to, maternal mortality? And what are the key challenges that are responsible for the high rate also of maternal morbidity that we have in Nigeria? Is it finance? Is it access to healthcare services? What will you identify as the main key issues with regard to maternal morbidity?
So thank you so much, Dr. Abati. I think it's a mix of all the, the different reasons you've given. Obviously, things like finance. Most women across our communities are not economically empowered, and they depend on their partners, their husbands, for them to even register for antenatal clinics. It has to do with structural issues like, things like bad roads even. In fact, from the project that we did in Kebbi State, one of the ladies that died, unfortunately, Auda, was in labor, 2 a.m. The husband was rushing out to the facility. But unfortunately, it rained, and the road, from where they lived was flooded. So they couldn't get to the facility, and she died. So structural issues like that also caused this thing. And obviously, the very poor access to healthcare in terms of primary healthcare centers availability, and even things around providing the right information to women and their partners to make the best decisions. And of course, issues around human resources for health. And I think that one thing that really bothers me as a public health physician in Nigeria is also issues around nutrition. Lots of women don't have proper nutrition. They are malnourished even before they get pregnant. And what that means is that, the odds are really stacked against them before they even begin to experience all the difficulties associated with pregnancy. And by the time you know what is happening, most women who are malnourished will be anemic. That means their blood level is very low. And if their blood level is very low, they can't even push very well when they are in labor. And when they eventually deliver, they may bleed to death because, their blood level is very low. So, Dr. Abati, it's a mix of all these reasons you've given. And really, it's just so unfair. Because, like I said, every year in Nigeria, about 58,000 women die at pregnancy, childbirth, or 42 days afterwards. And if we use the same statistics to extrapolate, that means that as of November this year, probably about 54,000 women have died. And people are not talking about it. People are talking about COVID-19 and other issues, that are there, that stare people in the face. So it's really unfair and sad. It's a great inequity. And what, us at EpiAFRIC, Nigeria Health Watch and Africa want to achieve is to amplify the voices of these community members so that Nigerians hear from them directly and hopefully get, everybody on board to make sure that maternal morbidity, decreases, so that consequently, fewer or no women at all die during pregnancy or childbirth.
Indeed, the ideal number is 0, quite frankly. I'd like you to talk about the common issues like preeclampsia and postpartum hemorrhage that cause deaths. And also, in this whole conversation, when the Pfizer vaccine was announced and everybody was so excited, until it became apparent that there were logistics issues, such as the temperature that it needs to be stored at. I remember the issue of oxytocin in Nigeria. I'd like you to talk about that as well.
Yeah. Okay, so the commonest cause of maternal death, during pregnancy, childbirth, or 42 days after is postpartum hemorrhage. And that's just a fancy way of saying the woman bled excessively after she gave birth. The baby has come out. Most instances, the babies will survive. But unfortunately, the women will die because, of the excessive bleeding. And also because most of those facilities don't even have blood banking services for you to say, okay, let me get blood and transfuse and ensure that this woman survives. And I'm happy you brought up oxytocin, because even one of our partners, the US Pharmacopoeia, working in Nigeria, they did a survey 2 years ago to find out the kind of temperature at which oxytocin is stored, and even if the health workers, and this includes doctors as well as midwives and other health workers, knew the right temperature to store oxytocin. And unfortunately, we know what the power situation is like in Nigeria. So you can rest assured that most of the oxytocin that women would get in order to help the uterus contract after delivery, because that's the essence of the oxytocin, for the uterus to contract. When the uterus contracts very well, that means that bleeding will be very minimal. Most of those oxytocin are probably not stored in the right temperature. And what that means is that a woman is bleeding, health workers are struggling to make sure that this woman doesn't die, and this woman, stops the bleeding in the woman. They are pumping oxytocin. It's not working. And at the end of the day, the woman becomes, yet another casualty. So there are just so many odds, that women are faced with in Nigeria and so many other parts, developing countries, and indeed even some developed countries, as far as giving birth and giving birth is concerned, and issues around the cold chain system, storage of different drugs, and even things like availability of the right human resource for health. So for instance, do we have an adequate number of midwives? Let's not talk about doctors. Do we have adequate numbers of, nurses and in those facilities? Those facilities, are they properly situated? There are instances where you find that facilities are like 30 kilometers away from the nearest household. How do the women get there when they are in labor? You see instances where these women are conveyed in ramshackles, called vehicles, to convey them to give birth. So the problems are legion. There's no doubt about that. And what we try to achieve through the Giving Birth in Nigeria project is say, it is time for us to really put this at the front burner of national discourse and to amplify the voices of the people, because what we did essentially was just work with community-based organizations in those states where we worked in, who went on a weekly basis to communities to find out if women died, why did they die, what could have been done differently, and what roles they can play in all this. And so we think this is an emergency, And I totally agree with you that is 0 woman that should die, during pregnancy, childbirth, as well as 42 days after.
But the shocking thing, a lot of women are still dying. I mean, I want to talk about something that is prevalent around the world today, and for the next 1 week, we're constantly talking about gender-based violence. In fact, flags are being flown at half-mast in South Africa to commemorate the death of a lot of women that might have died as a result of this. And Nigerian women are not spared during pregnancy. We have a lot of violence, that affects the entire process of parturition itself, that affects the health of the neonates and the likes, that affect women, when they give birth. What's your take on this? It has led to, profuse bleeding, as regards the birth process, because most parts have been damaged due to violence, and this violence perpetrated by their spouse and people close to them. Some have even been killed by guns where they were heavily pregnant. Is there anything your study is doing as a result of that?
Yeah, so gender-based violence and even violence against women during pregnancy is quite rife in Nigeria. The National Demographic and Health Survey that is done in Nigeria every 5 years actually unpacks that at zonal levels for you to see that across the zones in Nigeria, women undergo all sorts of violence, physically as well as emotionally during when they are pregnant and even when they're about to give birth. And you've given very good examples about a woman is pregnant, she's being beaten, they're kicking her abdomen and all, and before you know it, labor comes and she loses that baby, she bleeds and all. And I mean, there are also instances, let's not forget that gender-based violence as far as pregnant women are concerned also happens in health facilities. In fact, last year I wrote an opinion piece about how to stop the physical abuse of women during pregnancy and childbirth. You go to health facilities where a woman is in labor, she walks in, by the time she's in labor and she's trying to push, she's not pushing very well, the next thing you see is maybe the nurses, the midwives, or the doctors maybe slap her on her lap and ask her, to push, and start even, taunting her and, kind of making very derogatory statements. Was I there when you people were getting pregnant? Push her, beg. What is even wrong with you? Such things are also violence because there are instances where women, totally refused to even push, or they pushed very hard, and because of that, they had all sorts of tears as a result of it. Another research that we did, in 2016, looking at women who are pregnant but also HIV positive, the kind of stigma that they face as far as violence is concerned when they go to give birth, it's probably double what the average woman faces. So, and I'm happy that, we're now in the 16 days of, advocacy against gender-based violence. And, the different authorities involved in ensuring that this stops must come on board. And I think most importantly are traditional leaders, cultural leaders, religious leaders, because these are people that people really respect and revere. They must speak up against it. When it happens in the communities where you have all these leaders present, or as a religious leader is reported to you, you don't just let it lie low. You have to report to the state authorities so that it will be investigated, and so that the people who are found guilty would, be properly, the law will be properly meted out to them. So it's a sad thing, but I hope that as more people begin to speak up, as more people begin to, report to authorities and actions are taken, and as more health workers are trained on patient-centered care. Because that's another thing we found out and made as a major recommendation from the Giving Birth in Why Women Dying in Nigeria report, to say we need to train our health workers on how to provide patient-centered care. And that patient-centered care simply means that everything revolves around the patient. We must provide care to the best we can to make sure that it meets the needs and aspirations of that particular patient. So, it just has to stop. We can't keep on, going this way, especially with all a woman has to deal with being pregnant, taking care of her family, going to sell her wares in the market, and yes, she gets back home and somebody is hitting her, or, somebody is, being emotionally abusive to her. Those things are wrong and they really need to stop. And, every stakeholder involved in the communities must be part of this effort to make sure it stops.
Well, Dr. Nsofor, let's look in the direction of solutions. What do we do? What should be the role of government? Yeah. I know you already alluded to primary health care, where you find the majority of our women located. Maybe also about funding or health insurance. Every time we hear stories about women who give birth in some of these hospitals and they are detained. They are not allowed to go because they cannot pay. And some of them, develop other illnesses in the process. So it's a very serious problem. So what do we do about it? And secondly, your group, EpiAFRIC, talks about health and a tech platform. Now, what do you do with that tech platform? Is it telemedicine? And how does that apply at the level of maternal health or reproductive health, as it were?
Oh. Okay. So thank you. Let me talk first about the solutions. So yeah, we've talked about primary health care, and you're absolutely right, Dr. Abati. What you said about health insurance, I think if one of the major takeaways I want, the viewers to take from this particular episode is we must prioritize, health insurance as a people. Because what happens most of the time is that people wait until they are sick before they now begin to pay for health care. In so many instances, when you're sick, you're not even, financially viable for you to begin to pay for, health care yourself. So I want to see a situation where we have affordable health insurance, across all states. And I'm happy that, virtually every state in Nigeria, about 31 states now, have their own state health insurance laws. They have state health insurance schemes. I want to see these schemes begin to implement because some of the premiums are actually quite affordable. One of the states who supported as EpiAFRIC in developing a communication strategy for their health insurance is Niger State here. And their premium is like 7,200 naira per year. And it covers pregnant women. It covers, vaginal delivery as well as cesarean section. So people must begin to prioritize and save for health insurance and actually buy health insurance before they fall sick, because that is really very important. But some other recommendations as solutions from the Why Are Women Dying in Nigeria report is we must begin to engage our leaders, in our communities, because the evidence is that more women give birth at home than give birth in the facilities. So if more women give birth at home, that means that we have to find a way of educating women, but most importantly, educating men. Because sometimes we forget that we live in unfortunately, a patriarchal society, and men have lots of influence in their families. So that education aspect for women and their partners to prioritize facility-based delivery must also include men, so that everybody is carried along. I've also spoken about training of health workers to begin to deliver patient-centered care. As a doctor, it's a sad thing that when people come to health facilities, they are scared because they don't even know how people will speak to them, how they will be attended to and all, which is such a terrible thing. A health facility should be a place where people can walk into knowing that, people who work there are empathetic and will understand, the things they are dealing with and provide patient-centered care to them. The second thing you spoke about, so in EpiAFRIC, we have our Health Meets Tech program, which we started in 2017, was supported by Facebook to organize hackathons across Africa. We've done hackathons, and hackathons is bringing health and tech people together to begin to develop health tech solutions, that are relevant to our own context. We've done hackathons in Nigeria, at the CC Hub, at Ventures Park here in Abuja, as well as in iHub Nairobi and the Impact Hub in Johannesburg. And one of our hackathons that we did in 2019 was actually on maternal health. What we did was, gather health and tech people again to say, what are some of the ways we can begin to develop, relevant and context-specific tech solutions that will help us here. And I'm happy to say that the group that won that hackathon we did on maternal health last year, what they came up with was actually a very innovative way of paying for health insurance. And what they are doing is that, they encourage people, women and men and children in communities to go around and gather plastics and other, recyclable waste and bring them you know, and use that, whatever it is that they are paid for it, to buy health insurance for themselves, which we think is quite innovative. You know, they are the team that won. The name of that organization is called Social Care. And we're happy that, you know, they are beginning to get a lot of mileage from different organizations wanting to study their particular model of, you know, using recyclable materials that women can and young people can gather, and using that to pay for health insurance. Because that also has an added advantage. It also helps us deal with environmental issues as well as climate change, but most importantly, maternal health.
Well, I think it's important to say, relating to your point earlier about the abuse that women face while giving birth in Nigeria, that it happens all over the place. God have mercy on black women. In Western societies, there's this perception of the hypersexualized welfare queen with a lower pain threshold than white women, which results in black mothers dying at a 5 times higher rate than white women. But I just wanted to ask you, before the virtual launch of your report on Monday, just very quickly, what are sort of the best practices that you can identify since you went all across the 6 geopolitical zones? Is there any silver lining that you'd like to share?
Yeah, one best solution that we identified is that the community people are interested in being part of the solution. But most of the time, because of, say, education level, exposure level, and things like that, and not even knowing who to contact, you know, as per government or other organizations to help them deal with certain issues, you know, they're a bit shy. And that's why, from inception, we decided that in this report, it is the voice of the people that we want to amplify. The people themselves have really come to the realization that this is a problem that has to stop, and they are willing to be part of it. And this is where government and civil society organizations must begin to now say, okay, how do we work with you people so that you become part of the solution? Because all the different reasons why women die are preventable. You know, so working with those different community structures, community leaders, we're very confident that, you know, we'll begin to reverse this trend, and hopefully we'll get to a position in Nigeria where, when a woman is pregnant and she tells you, don't start wondering whether she's going to survive or not. You know for sure that, that pregnancy is going to end successfully.
Thank you very much, Dr. Nsofor. Thank you for joining us.